so much for joining us today for our webinar on MSc in Evidence-Based Future Healthcare. My name is Lucy Heaney. I am from the Global Office here at University of Galway. I am joined today by the Programme Director, Elaine Toomey, who's going to bring you through her presentation. On the right-hand side of your screen, you'll see a live chat where you're welcome to ask any questions that you might have, and we'll take those questions after Elaine's presentation. Thank you very much. I'll hand over to you, Elaine.
Great, thanks Lucy, and welcome everybody, and thanks so much for joining us online. So I'm going to just take you through our programme, and hopefully we'll have time for questions and that kind of thing after if you have any questions. So our programme is the Masters in Evidence-Based Future Healthcare. Delighted to say our applications are now open for September 2025. For any questions or queries, you can contact us anytime at futureevidencemsc@universityofgalway.ie, and you can find our website using that QR code as well. Okay, so just want to highlight that the closing date for applications is July 31st, but there is demand, so I suppose getting your application in sooner rather than later is advisable. So I suppose just in terms of why we set the course up, so it's a fairly new course. Will be its second year in September coming. And why did we set it up? Well, I suppose evidence-based healthcare, for any of us who work in healthcare, has always been quite topical. But I guess the healthcare landscape has seen a lot of changes in recent times, demanding a more up-to-date look at how we perceive and how we use and apply evidence-based healthcare in terms of what it is and how can we use that to achieve better outcomes for the health service, for patients, for people that we work with in more broader health settings. So for example, during COVID-19, we really saw a huge spotlight on the importance of accurate, realistic and up-to-date and accessible quick evidence, both for members of the public and also for healthcare workers and policymakers. Recent times we've seen huge digitization of health in terms of accessibility and availability of data for both patients and staff, healthcare workers, and I suppose knowing what to do with this huge amount of data, how to communicate appropriately to people, especially in an era of misinformation and disinformation. And these types of things are increasingly under threat more and more lately. So for people working in healthcare settings and for health settings more broadly, we need to be prepared for that and equipped for that and ready to deal with those challenges. Then we're also, I suppose, seeing the speed and pace of things like artificial intelligence and technology, and on the positive side of things, huge advancements in terms of how we can harness this technology better to improve outcomes for our patients and the people we work with. But alongside that, we also need to be aware of how to appropriately evaluate and implement and understand the evidence and the underpinnings of those interventions as well. So in terms of our course, we aim to provide healthcare workers from all different backgrounds, so whether it's providing frontline care or whether it's working in policy or management or administration, with the skills and knowledge to apply an evidence-based lens to your decision making. So the aim is really to address the current and emerging healthcare challenges, and that's why it's future healthcare, and also to bring in some cutting edge approaches to evidence identification, appraisal and implementation in conjunction with people receiving care. So for us, that's particularly important, that person-centered care piece of it. So our end goal is really to try and transform current practice and optimize healthcare outcomes. So this is just an overview of the modules on the course. So we have a module which is an introductory module, introducing evidence-based healthcare. Then we have a foundations of research methods and design module. Then we have a searching, synthesizing and appraising evidence module. So how you find research evidence or other types of evidence, how you appraise it, how you bring it together, what you do with it. Then we have a module on interpreting stats in healthcare. And that's very much, we want that to have a much more practical applied focus. So it's really about if you encounter statistics in journal articles or papers within your daily work or even in your settings, what do they mean for the actual patients and the people you work with? And how do you interpret that and use it in your decision making? Then person-centered care and shared decision-making, innovations in healthcare, so looking at the role of digital health and technology, advancing health equity through evidence-based practice, and this is a particularly important module, especially in the current day and age when things are very much under threat there, and looking at how we can make sure that our advances in healthcare are equitable for all. And then finally, then we have an applied project. So instead of a traditional 30 credit thesis, we have an applied 20 credit project. So this is, again, we wanted to make it something that you could use in your daily practice. So it's where students would come up with a problem and evidence practice gap in their current workplace, and that they would develop a solution, a very well comprehensive evidence-based solution to change that or to improve that. And the end, I suppose, anticipated outcome is that you would have something you could take back to your employers or your current workplace and apply tomorrow. So this is just a look at what the program structure is in terms of where those modules fit. So in the top here, we have the part-time structure. So in the first year, you have 2 modules. If we start in September, you have 2 modules in year 1 in semester 1, and then 2 modules in year 1 in semester 2. So our current students are currently in their second semester of their first year. Then if you're on the part-time program, then in the second year, you have 2 modules in September in semester 1, but you also start your capstone project. And then you have a 3rd module in semester 2, which starts in January. And you continue with your capstone project, which goes into the summer also. And then if you're doing the full-time program in year, it's 1-year program. If you're doing it full-time, then you have 4 modules in semester 1, plus you start your capstone, which, as I mentioned, goes into the summer. And then semester 2, then you have 3 modules and finishing out that capstone into the summer. So I suppose the key features of our module is that it's flexible online learning. We've very much developed this to be specifically developed for online. So it's not like panic COVID teaching where we were taking things that we used to do in person and just, stuffing them onto online, or, death by PowerPoint or Zoom recorded sessions for an hour. It's definitely not that. We've very much developed this in conjunction with our learning technologists here to make sure that it is really applied and very flexible online learning focus. As I mentioned, you can do it 1 year full-time or 2 years part-time. And that's, I suppose, just something to consider. From the previous slide, you'll see that the full-time program, like any level 9 master's program, the full-time level 9 master's, there's a bit involved. So in terms of decision-making, if you're working. So that's why we've 2 options. So as I mentioned, each module and assessment is highly applied to real-world settings, and that's been something we've gotten great feedback from our current students about, which we're really happy to hear, is people saying it's really applied. It's one of the most applied courses I've ever done, and that feedback for us is fantastic, because that's exactly what we wanted to achieve with this course. So it's interprofessional and interdisciplinary. So we're really trying to replicate what healthcare looks like, which is a mix of all different types of people and backgrounds and perspectives. So that's who we aim to have in our program. And it's also high quality training. So as I mentioned, it's specifically designed for online. We use very interactive and a variety of delivery modes. Again, we've gotten great feedback from the students in our course currently about that, which we're delighted with. We have an official partnership with Cochrane Ireland and Evidence Synthesis Ireland, so there are affiliated partners on this. And we also have lots of guest contributions from international experts in the space of evidence-based healthcare, which has been really exciting this year. So why do this course, I suppose? So in terms of thinking about benefits for your career, so master's is really beneficial for career progression, for things like pay, promotion, hiring. We see that people with master's degrees have higher pay than those without, often in many settings. It can prepare people for dual clinical academic roles, facilitate further progression towards further research or into a PhD. Can be a nice stepping stone for that, because it kind of gives you a nice wide, broad set of skills that you can start to apply. Can prepare people for patient advocacy or communication roles, or to be the evidence lead, say, within your team. In terms of the service, and this is something nice to kind of go to if you are working in a setting at the moment and you want your employer to maybe sponsor some of your participation in the program. This can be a nice kind of thing to sell to them, to get them to sponsor you. So again, that focus on applied evidence-based healthcare and that interprofessional approach to improving services, systems and patient healthcare outcomes. So we see that health organizations that implement evidence-based practice have better outcomes. So things like reduced length length of hospital stay and decreased patient mortality rates. So we see better patient and service level outcomes. We also know that healthcare professionals who practice evidence-based healthcare often report greater satisfaction. So that employee satisfaction piece as well. So things to go to your employer with if you're looking for sponsorship. And then I suppose from a personal development point of view, the content is really interesting and engaging, and really to, I suppose, help you reflect and improve on your own practice. It's competitively priced, so similar programs in the UK cost up to about 44,000 GBP pounds, which is about, I don't know what the conversion rate is at the moment, but it's probably over 60,000 euro, or in the US cost about $60,000. With this program as well, there's no accommodation costs needed and there's no relocation fees needed also. So that's something to bear in mind. In terms of funding for the programme, so the university does have a number of different scholarships that might be relevant for you. So for international non-EU students, there's a new one, it's postgraduate merit scholarships, which are available for 20 non-EU students across different programmes. Eligible students would be invited to apply for the scholarships after they accept their offer. So basically, you must apply for our programme first, receive your offer and accept it. And then if you're eligible for the scholarship, then you'll be invited to apply for that. So the process for that is opening soon and will be up online on that link there, the International Scholarships link. And for EU students then, there's for example, there's a postgraduate excellence scholarship if you've gotten a first class honours or equivalent in a primary degree. And again, more information for that on that is up on the university website. There's also other scholarships that may apply depending on your individual circumstances. And as I mentioned, employer-based scholarship can be a component of this as well for many students, especially if you can supplement that with a grant or one of these scholarships. So something to consider. So why study at the University of Galway? So we're in the top 2% of universities in the QS World Rankings. We're rated first in Ireland for sustainable development. The most, we've a lot of research collaborations with different institutions and industries. We're in the world top 50 for UN SDGs, and it really is an exciting place to study, and you do benefit from that when you're studying here. So in terms of endorsements for the programme, we're really honoured to have had some great recommendations for the programme from Dr. Carla Suarez-Weiser, who's the Editor-in-Chief of Cochrane, from Mr. Bill Maher, who's the CEO of the Bon Secours Health System here in Ireland, and from Professor Anthony O'Regan, who's the Chief Academic Officer here in Salehi University Healthcare. And I suppose what they've highlighted is the need for people with these skills and the need for this type of programme for their workers. So you can read those on our website later if you get a chance. So in terms of how the programme exactly works then, so basically what happens is weekly content for your module is released on Canvas. So Canvas is the learning platform that we use here. That is released on a Friday evening or afternoon, and then students work through it in their own time. So the key kind of learning unit is an interactive workbook. They're very interactive. There's readings, there's quizzes, podcasts, videos, lots of different types of learning activities in those. Often they'll be supplemented with discussion boards where you're talking to your colleagues and your peers in your class about your experiences, your reflections. And then we also then have live 2-hour online sessions every week. So every week for the full-time and every second week for the part-time students. At the moment, they're Wednesdays between 7 to 9 p.m, but that will depend in terms of who's on the course and where people are based geographically and that type of thing. Those live sessions, we know people work and people sometimes can't make the live session, so those are also recorded and uploaded to Canvas. But essentially that's kind of the structure to the programme and how it actually works. So in terms of the staff on the programme then, we have really great, enthusiastic, motivated staff from different aspects of healthcare. So people from physiotherapy, from the allied health, occupational therapy. We have people from health psychology, from bioengineering, from nursing midwifery, from sociology. So lots of different kind of perspectives, which is really nice. And it really does lend a nice flavour to the course. So who's on our course currently? So at the moment, we have people from a lot of different backgrounds, so lots of nursing midwifery, from occupational therapy, from speech and language therapy, some physiologists, some medics, some physios, social workers, radiation, people working radiation therapy, and people working in pharma. So, and again, we're always interested in growing this and looking at who else would be interested in doing the course, because that interdisciplinary perspective, I suppose, that piece of it is really important for us. So what do our students say? So this is just a quick snapshot of one of the module evaluations from semester 1, which had a 70% response rate from students. So you can see here that really high agreement in terms of the clarity, organisation of the modules, access to materials, the teaching staff, and I suppose our patients, and coursework and learning activities. So really, again, really delighted to get that feedback. And some of the qualitative feedback students gave us was, the mixed methods approach made it very engaging, easy to integrate into daily life, really nice real world examples to theory and helping understanding, and then discussion boards helping for gaining insights from different clinical backgrounds. And again, highlighting real world examples of the implementation of evidence-based practice, and the teaching style being very accessible and engaging. So that's just a quick snapshot in terms of how our current students are finding the course. So we have 2 really lovely testimonials from current students. Again, you can read those on our website, but they're from Maria, who's the Associate Director of Nursing Acute Haematology Oncology Service in the NCC in Ireland, and from Geraldine Shields, who's an occupational therapist in primary care. So again, representing, the different backgrounds of students in the course and how they're finding it so far. So in terms of entry requirements, then you require a 1-1 or 2-1 or equivalent bachelor's honours degree in a healthcare related field. So I suppose just to say that, we do consider things on a case-to-case basis, because we recognise the importance of kind of practical work experience and that piece as well. And healthcare related field is quite general because it is a general area. So so if you're not sure, please do reach out and just contact us and ask, and we can talk to you individually. So we do ask people to have relevant work experience. So in some aspect of healthcare, it doesn't have to be a clinical role, or it could be. Again, the diversity of backgrounds is very much welcomed. And again, if you're uncertain, please do reach out and contact us. So in terms of how to apply then, so you would go through the University of Galway postgraduate application system, like with all other applications. There's a personal statement, 2-page CV, and then just the usual qualifications and transcripts. And if English isn't your native language, then English language competency. And that is kind of everything. So I'll be delighted to chat to you further and take any questions if anyone has any questions or comments. I'd love to hear them. Thanks.
Thank you so much, Elaine. That was really interesting to see the backgrounds as well that people come from.
I might actually just leave up because of the QR code. I'm just conscious. I might just leave that up for a little bit. And then
yes, of course, that would be useful. Very useful for people to ask questions. So, yes, for anyone watching, you're free to ask any questions that you might have here on the live chat. I'm glad to see that you could log in on your phone there, Carmel. I know you had some difficulties at first. So any questions that you might have, leave it for a moment or two.
And just to say as well, if you had issues with sound, Carmel, with this session is recorded, so we'll be putting this up onto our website, to the Master's website shortly, so you can watch back anything you might have missed.
Okay, Michael, could you explain in more detail about the continuous assessment of various modules and how they work? Greetings from Austria. Hi, Michael.
Hi, Michael. Nice to chat to you. Yeah, thanks. So all the modules quite different. So say some of the modules, as I mentioned, would have discussion boards. So the continuous assessment, say for example, the first module, which is the introduction to evidence-based healthcare. What we've tried to do, I suppose, across all modules is to make sure that there aren't too many assignments coming together. So we've seen that before with students getting quite stressed if everything is always at the end of semester. So we've looked at that across all modules and looked to see where we can kind of space things out a little bit, put different percentages available for different assignments across the different modules. So for example, the first module, the Introduction to Evidence-Based Healthcare module, is continuous assessment, in that there are 3 different assessments on the module. There is a discussion board, which is graded, so 10% across the entire module, and every second week there's a 2% discussion board task, which is linked to the reading that would have been sent out the previous week. So you get the workbook the previous week. It would kind of prompt you to just, to think about a reflective question or some sort of question. And then that's the topic that you would be then asked in your discussion board in the following week. And that would be worth 2%. Then there's a group work presentation midway through that semester, which is worth 20%. Now, these will change from year to year, but at the moment, this is how this one looks. And then there's a final individual written 70% assessment at the end of semester. And then the other module in first semester is similar, in that there are discussion boards that are graded, and then there's a larger written assignment towards the end. Then some of the other modules don't have discussion boards. Say one of our current modules has 5 assignments for 20%. And those are split out over every 3 weeks. There's a component due to kind of build up to a whole. And then some just have one final assessment at the very end for some of the modules. So that's kind of, I suppose, there's a variety across the different modules, a variety of approaches, depending on what the kind of key aims of the module are, what the learning outcomes are, and how it fits with the other content in the module in terms of what's taught. So I hope that's enough information, but do follow up with me individually if there's more information required.
That's perfect. Thank you, Elaine. Okay, thank you, says Michael. Thanks, Michael. If anybody else has any questions, please feel free to put them into the chat box. Or if not, if you're watching this in retrospect, you can still use the email address provided there to ask any more questions that you might have if you want.
Yeah, and just to say as well, so I've mentioned it there in the last slide, but do sign up for our newsletter. That'll keep you updated if there's new scholarships or anything like that coming out, or if there's any updates to anything. So it's a handy way to keep updated, and you can access that through that link there, or the QR code. And as Lucy said, anytime if you want to contact us, you can do so with questions to that email address up there.
Perfect. Carmel, is there a choice in modules, or are they all compulsory?
No, at the moment, Carmel, they're all compulsory. So they all form the 90 credit masters. So there's 7 10 credit modules and then 1 20 credit module. So that's the 90 overall. So at the moment, we're happy with that structure. Down the line, we might look to introduce additional modules that then could be optional in terms of people might have a choice between different types. But at the moment, the modules that we presented there, they're all the modules on the programme. They're all compulsory.
You're welcome, Carmel.
No worries. We're always looking for new ideas as well, so for future development. And that's, I suppose, an interesting thing about future healthcare is that the modules we have on this year may look very different to what we have on next year or the following year. So, so we will be, I suppose, updating and revising continuously. If you have a course called Future Healthcare, you can't be too out of date.
Exactly. It makes it very exciting.
It does. A bit of work, but exciting at the same time.
Okay. I think that's everything, unless somebody else has anything that they'd like to type in there. Seems to be everything. Thanks so much for joining us, and thank you for your questions. It's always good to get feedback. Thanks so much, Elaine, for joining us. Take care, everyone.
Thanks, Millie and everyone. Thank you for coming. Take care.